and thanks for signing up to our webinar. My name is Lisa Hornung. I work as a senior researcher at NCVO, and I will be presenting findings from our Residents as Volunteers project. In this webinar, I will give you an overview about the project, things we knew before we started doing the project, the main findings from the project, and conclusions and outlook. This will take about 30 minutes, and after that, there will be some time for Q&A. But what is the project actually about? So in this project, we aim to support people who are aged over 75 and who live in Abbeyfield homes to volunteer. We've explored some of the barriers they have been facing and the benefits that volunteering had for them. And in the end, we aimed to generate good practice evidence around effectively engaging that particular age group. Before we get started, we will now have a poll for you, which you should just now see on your screens. And in this poll, it will ask you, what do you think is the biggest barrier facing people aged 75 and over when it comes to volunteering? So there are three options for you, and one is, do you think it is a lack of knowledge of how to get involved, so to find opportunities or to find things that you want to do? Or do you think, is it rather physical and mobility issues? Or is it the organizations with poor attitudes and poorly trained volunteer managers? So some of you might actually be working with volunteers or even managing volunteers that are in this particular age group, or you might just have a go at it and guess what the biggest barrier for those people is. And we will have the results in. Okay, most people actually think it's lack of knowledge of how to get involved. We will get to that later, but actually, in this project, we found that the biggest barrier volunteers were facing are physical and mobility issues. In terms of who was part of this project, so we had the participants. These were residents who we got into volunteers. We had inspirational volunteers who were people from the local community who got recruited to support residents in their volunteering. And we had staff at the homes who coordinated and supported residents in their volunteering activities. And in year two, which this presentation is based on, we recruited 72 residents from 26 homes. And in terms of who delivered the project, we, NCVO, were at the research partners, so we have worked on the evaluation, and we worked together with the Abbeyfield Society to deliver the projects in their care homes. In terms of evaluation design, we've decided to use mixed methods, including a pre and a post survey with the residents. So before the project started, and then 6 months after they've been doing volunteering, they got sent another survey to fill out. They've also submitted monthly monitoring data. So they filled in spreadsheets with information about the types of volunteering they've been doing and how many hours they spend doing it. And we also did interviews, more in-depth interviews with the volunteers themselves, but also with staff and inspirational volunteers to get different perspectives. What did we already know before we did the project? So we know from existing research that volunteering has many benefits for volunteers, especially those in later life. But we also know from the Community Life Survey and other volunteering surveys that rates drop for people aged over 75. So this chart below is data from the Community Life Survey and shows that formal as well as informal volunteering rates drop for people aged 75 and over. And we also knew that there was a lack of research into the older old. So most of the existing research actually defines older people as over 50, most often they focus on formal volunteering, and they often use existing data sets, so they don't collect their own data. And this is probably due to the fact that doing research with older people is quite challenging. So collecting your own data and designing a research study is quite challenging due to the range of symptoms and circumstances, and especially when it comes to cognitive impairments and dementia, those can really affect on all stages of the research process. And we specifically know that residents in care homes face particular challenges. So they are typically old, so the majority of people living in care homes is actually over 65. They most often moved away from their home and neighborhoods, so potentially they have moved away from their support networks. They often experience significant transitions, and most of them live with more than 2 long-term conditions. And this is reflected by a quote from an Abbeyfield house manager who said before the project, "Many of our residents are much older and have a range of mobility issues as well as mental health conditions." So we thought that those residents would actually very much benefit from this volunteering project. And what did we find? First, when it comes to recruitment was successful when it focused on roles rather than recruiting volunteers. So most of the residents actually didn't see themselves as volunteers. So for them, it was quite normal, the things that they did. It didn't appear to them as a special volunteering activity. And the recruitment process actually differed quite a lot between the houses. Overall, you could say that successful recruitment adopted an open language, they focused on specific roles, and it was very much resident-led. And staff were very aware that they had to be careful in how they approached residents. So they were conscious that residents should be leading and they shouldn't feel pushed to have to volunteer. And before we move on, we actually have another poll question for you. So, what do you think was the most common type of volunteering that residents got involved in? And we distinguished between 4 different types. So do you think it was informal volunteering activities, formal volunteering, inside the home, so this could also be outside in the garden, but somewhere on the Abbeyfield site? Or do you think most residents actually volunteered outside the home, so not on an Abbeyfield site, but maybe in somewhere in the local community, local church, or the school through an organization? And you should now see the results. Most people think that it was informal volunteering. And this is what we found as well. So we found that most of the residents actually got engaged in informal volunteering activities that were inside the home or on an Abbeyfield site. And we also distinguished between domestic roles and social roles. So domestic roles were like helping with stuff that needed to be done in the home, like making tea, setting a table, but also gardening. We had lots of residents who actually got engaged in gardening activities. And the second most common activity were socially focused. And this included groups like music groups, board games, organizing book clubs. And we had lots of residents who started doing knitting groups, knit and natter. And fewer residents actually decided to volunteer outside in more formal roles. And this is probably also due to the fact that they were facing more barriers when it came to volunteering outside the Abbeyfield site. And when it came to what they were actually doing, Most of the roles were linked to residents' interests and previous experiences. So these could be hobbies, but also professions. So we had an ex-yoga teacher who decided to start a meditation group in their Abbeyfield home, or someone who worked as a head of a library in his career, and he decided to start a film club. And some people who had done and enjoyed painting all their life started to run arts group for other residents to join in. Throughout the volunteering, we found that support was crucial for a positive experience, and this probably isn't very surprising to you. And within the survey, we found that most residents actually were quite happy with the support they got from staff or inspirational volunteers, if they existed. And, and more generally as well, with the coordination of activities or dealing with problems. But only a few homes actually had inspirational volunteers, although they acknowledged that the role could have had a lot of potential, but they needed far more support and guidance in recruiting people. So a lot of the homes didn't really have the time or didn't really know where to find and recruit people to those roles. So they decided that a member of the normal care staff should take on the job of coordinating the project. But they acknowledged that it could have had more potential if they had recruited an inspirational volunteer. In terms of barriers, we've had the question at the beginning. We found that residents were facing a lot of barriers when it came to volunteering, and they were faced with barriers on a practical level, such as health, transport, lack of demand and commitment, but also on a more psychological or cultural level. So a lot of them actually, for them, it was a lack of confidence or feeling too old or not wanting to volunteer. And there were also a range of barriers on home level, but we come to them in more detail in a minute. In terms of on resident level, feeling too old and health conditions were the major barriers. So they came through a lot and strongly through the interviews, but they were also the top two barriers in the survey. So we gave them options, and the top two were I'm not the right age, or I have an illness or disability. But also significant were things such as lack of confidence, a narrow view of volunteering. So some of the residents thought that they had to go out and volunteer in a charity shop. But running something like a music group or an arts group, that wouldn't be volunteering. Some of them actually were resistant and didn't want to get involved. And there were other practical barriers why they couldn't do it. In terms of the home level, supporting residents, and we know that support was crucial, actually required time and skills. Although the time varied quite a lot between the houses, and it depended on whether there was a volunteering culture before in the house and how much the residents actually interacted with each other before the project started. And it also depended on the nature of residents. So whether they were quite confident and active and eager, so they didn't need as much support as other residents. Additional barriers were facilities in the home that were available to support groups. The staff to resident ratio very much affected how much time staff had to support residents volunteering. But also on a management level, we found that buy-in from the senior management was very much an important driver in the success of this project. And we found that most of the staff were actually quite keen to support the project. And some of them were really sad and disappointed that they didn't have enough time or resources to support residents more. But some homes were actually really good in overcoming some of those barriers. And how have they done this? Some homes have continuously encouraged and motivated residents to overcome barriers that were linked to lack of confidence, for example. Some homes were really good at tailoring roles to resident needs and providing roles that had low commitment or that residents could get engaged in even though they had mobility issues. One home created networks with the local community. So one example was a home that had an arrangement with the local library so that a van would come for residents so they could pick up books for their book club and didn't have to get to the library in the town centre. Another home paired up residents with external volunteers. So for a garden project where that involved a lot of physical work, the home found the local school to be interested and to pair up with residents to help them with that. Some homes were also really good at raising awareness and celebrating volunteering and everything that was happening, which then encouraged other residents to get involved. Some homes also ran fundraising events to get more money in to support the volunteering that was happening. And before we get on, I have a last poll question for you now. You should see it on your screen now. And this is asking you about where do you think volunteering had the most benefits for residents? So we've been talking a lot about the barriers that residents were facing, but where do you think residents benefited from what they were doing? Do you think it was emotional well-being? Was it better for their social well-being, physical well-being, or mental health well-being? And I think we should have the okay, this will be quite interesting to see what you think where it had most benefits. So and also thinking back about the biggest barrier that was physical issues and mobility issues. But actually, most people think that it was benefiting most on their social well-being. So overall, first of all, we found that volunteering had many benefits on all of those levels. So on the emotional, social, mental, and physical. But we found that the social and emotional benefits, so as most of you thought as well, were highlighted more strongly in the interviews. So something like seeing an achievement, seeing the results, but also knowing that people appreciated and get acknowledged for that. Or just the fact that people didn't have to be by themselves and they could meet other people and socialize, which wasn't always the case in all the homes necessarily. But not just the interviews highlighted that. Those benefits were also really highly rated in the survey. So below you can see the top 6 most important benefits rated by residents. And again, it's about the enjoyment or satisfaction from seeing the results, using skills and doing things they are good at, so they have a sense of achievement. But when it came to impact, although we found that volunteering had a lot of benefits, when we then explored the impact over time, so comparing changes in well-being measures, that was far more difficult to come to a strong conclusion. So some measures of well-being decreased, while others have increased. But most of these changes are not statistically significant. And the data suggests that many factors are involved. So the chart on the side shows you the rating of volunteering on well-being. So the residents rated the impact of volunteering. by the life event they have experienced in the last 6 months. And it shows that people who had experienced a very negative life event in the last 6 months, so maybe having an illness or someone passing away, they rated the impact of the volunteering far lower than people who had positive or positive and negative events. Okay, coming to the conclusion, some of the key findings as a summary. So we found that most volunteering happened inside the home, and some of the potential reason is that they might be facing fewer barriers, so not having to get transport or finding an opportunity that is low commitment, that is informal outside the home was a bit more difficult. And we also thought that recruitment may have focused too much on engaged residents. So a lot of the residents who got involved in the project had actually already volunteered in the home or at some point in their past. We also found that support was crucial, but it required a lot of time and skills from staff. And residents faced a number of barriers, but there were ways to overcome them, and some homes were really good at that. We also found volunteering had clear benefits for the residents, but coming to a definite conclusion in terms of impact, that was more difficult to measure. Some of the recommendations that we base on those findings is that if you're thinking about setting up a similar scheme, or you're working with volunteers who might be in that age group, we think it's important to adopt a broad view of volunteering and volunteers, so that residents don't get offended who might not want to be labeled volunteer, and give them ideas of what else they could do, what they might not be seeing is volunteering. We also think it's important to develop tools to help recruit volunteers, so that staff in care homes are able to recruit their residents into volunteering and enhance the volunteering experience. Some of the things that we have used in this project is promotional films, such as the one that I just showed in the beginning, but we've also developed a brochure which showed some of the examples that residents did as volunteers. We also think it's important to address barriers, and we have shown some of the ways that how this could be done. But you should also be realistic about the levels of involvement. So some people might just not be able to commit to volunteer, or they might not want to, and that's fine as well. In terms of how the project was set up, it had the idea to create a role of inspirational volunteers, which were recruited from the community to help the home in coordinating their volunteering. But we found that this hadn't really worked in the way it was intended, so very few homes had recruited those volunteers. And we think that the role needs to be reviewed, and some of the feedback suggests that maybe the title needs a bit of redoing, and also homes need more tools to help recruit those people. We also found that you have to be realistic about the time that is required to effectively support residents in their volunteering. Especially when it comes to care homes, we know that staff are very short of time. So be realistic and think about how they could be supported. And in terms of this project, we found that having a centralized support, so this was the Aberfield headquarters who coordinated this project, was actually very good and successful driver in this project, and especially showing leadership in growing volunteering is really important. So we're now through my presentation of the findings, and we will start with the Q&A now. So if you have submitted questions already, then I should be able to see them. but feel free to still add to the list and I will see how many of them I can answer. And maybe just to get started, we could, yeah, so one of the first question, will residents have the chance to continue volunteering after the end of the program? Yes, although it depends on the homes. So most homes and most staff are really keen to continue the project because they were really happy to see how it has grown, their volunteering and the residents, how they engaged. Many were really surprised of how many residents actually got involved. And they're very eager to continue in supporting residents in doing what they've started. Although it probably have less centralized support because Abbeyfield had an overarching project manager who is not there anymore. But hopefully they will be able, because of the learning that came through the project, to still continue and grow residents in their volunteering. And maybe another question that was linked to that. So how were the activities funded? So this project was funded by the Big Lottery Fund. It was set up as a 2-year project, and year 1 was supposed to work as a trial to then inform year 2, in which we extended the project and recruited a lot more residents in their volunteering. And this meant that there was a small budget for each home which they could spend to support the volunteering that was happening. But we found that it very much varied between the homes, whether they make use of that and whether they needed that money. In some homes, they were they had quite a lot of volunteering going on already. And some of them, as I mentioned before, also ran fundraising events. Some had made use of the gardening volunteers that had really created a big community garden to then have a summer event where they showcased everything that the volunteers did to then again raise money that would go back and support the activities. And some homes were really creative in how they wouldn't need to have much money to support their volunteers. So the link, for example, with the local library didn't cost the home anything. So it meant that the home didn't have to spend money on transport for the residents to get to the library. But the library sent a van so residents could have access to books to support their book club. But we also found that for some residents, this was actually a barrier because the home didn't have as much money available to them, and they felt they didn't have that money to spend on their volunteering. So it limited them in what they could do. So I know that this might be a problem, but I'm sure that there are ways, and we've mentioned some of them, of how that could be overcome. Okay, a question on the volunteer recruitment. So we find it difficult to recruit older volunteers. What tools did you use to recruit residents as volunteers? So we had, as I said, we had this overarching project manager who was really good at recruiting volunteers. And some of the tools that we have designed was the promotional films, so the film that I shown at the beginning, which is looking at the different volunteering activities that residents got involved, just to give other residents ideas of what other homes have been doing, or things that might be working in their home as well, or things they might be interested in. We also had a brochure that was very much personal stories of other volunteers who had done things and who shared their experience, what they gained from doing it. But I know that some of the staff actually said, and it came through the evaluation, that they would have wanted more training and a bit more formal induction on this, because they found it quite, some of them found it quite difficult to recruit volunteers. And we found that they needed quite a lot of support along the way. So usually they would sit down with them, have a one-on-one introduction in the project, but overcoming the lack of confidence and things like feeling too old or not feeling like a leader, that was one of the major barriers for some of the residents. So that needed a lot of ongoing support, encouragement, motivational support that might not be available for everyone. So if you're recruiting older volunteers, but not in a care home context, then I'm not sure of how much that support you can actually provide. But we will share with you some of the outputs that we have produced, including a good practice guide. So there should be some tools and checklists to help you through some of the practical issues. Maybe another question. With residents doing external roles in the community, did they have to go through an application process? If so, did they face barriers from the recruitment process? Actually, yes. So that was another barrier that I didn't mention. But first of all, there weren't too many homes who tried to do that. And it was probably also due to lack of knowledge. Some staff were fairly new to the community, so they didn't know about opportunities that might be available to residents. And then others had already links in the community, but they still didn't know where it was most suitable for residents to go to, or they couldn't set up transport links. So I know residents that were interested in even working in a charity shop set, they couldn't find a way to get there on a regular basis, and they would have had to organize it themselves because the home couldn't provide that. So those were barriers, but there were also barriers in terms of application. So some residents were interested in working with children and they had to go through the normal checks. And because this was quite time consuming and formal, in the end, they didn't go through with it. So the residents would have liked to do it, but then they were faced with a lot of the procedure and that put them off. So they decided to not do it, but then instead do something in the home. So yeah, just as a response, they did face barriers, and some of them could be overcome, but others just didn't work out for them. Okay, with God, just looking through the questions, there are some very interesting questions. I'm not sure I can answer all of them. Was there an appetite from volunteers or home staff to explore volunteering outside of the home after the project? I would say definitely. So a lot of the homes were really pleased to see how the project had grown and how many residents actually got involved. So some staff were a bit skeptical at the beginning whether they could actually recruit residents to the project, and they were pleased to not even make up the numbers but see what impact it had or what benefits it had for the residents. And because of that, in some homes, it had really much grown on being a fairly small scale project to all of a sudden having people from the community joining in because they saw that the home had started doing a bit more garden work. So they got involved and it kind of grew and grew and grew. So, and I really hope that from the reports we've done and the other good practice guide that the homes will have even more ideas what they can do and how they can overcome barriers. And some of the staff had mentioned that they would have liked to have networks or links with other homes that had done the same projects, just to get ideas and share learning, or maybe even arrange exchange between the homes, so residents could kind of show other homes what they were doing. So yeah, and it's definitely been very positive for most homes, and they're eager to explore how they can get residents even to volunteer outside and link up with organizations and the local community. Maybe a bit more of a research question. So how could impact be assessed more effectively? So that is a tricky one. So we found, so the evidence that we gathered around the benefits, it's mainly from residents reporting that they benefited in some ways from their volunteering, or through the interviews where it really showed in the way that how they talked about their volunteering experience, and how things, even in the home, might have changed in the dynamics. Also staff talking about that. But we found that work assessing and trying to assess this with surveys and with numbers was really difficult and very time consuming. So we had a fairly low sample size to really statistically evidence that it had an impact on their well-being. So looking back, we probably would have done rather interviews before the project and after the project on specific issues to show to find out whether it had an impact on certain areas of their life, rather than trying to get them fill in surveys, fill in monthly data, hours logs, which really asked a lot of those residents. And yeah, so that as a response. Another question. Okay. Maybe a practical one again on recruitment. So I coordinate volunteers at a hospital, and I would love to appeal to older people to volunteer. I have roles that could easily be supported by others, like warding drinks. How could I appeal without sounding patronizing? So yeah, that kind of links to some of the stuff that I've been saying before around the recruitment, and staff being very aware that they had to be careful in how to approach residents and not push them, but still kind of motivate them, give them ideas, engage them in something that they might not have done before. And I think, yeah, so I mean, I don't work as a volunteer manager, but I imagine it's to be kind of a slow moving process in suggesting something or sitting down with someone who you think might be interested. Ask them about what their skills are or what their previous experiences, what they enjoy, what their hobbies are, and then maybe think about ways of how they could get involved, whether they would be interested in helping out, or suggesting areas in where you think that they could help. But yeah, again, not trying to be pushing them, but showing them also the benefits that it could have for them, but also the people they then support. Okay. The last question. So with our older community having a higher rate of social isolation, did you use a different approach to volunteer support and management through your scheme, allocating more time to have conversations with your volunteers? So I think because of the context that it was happening in a care home, it was probably a bit different anyways. So there was care home staff working really closely with the residents. And in some homes, they had a really engaged social life already going on. So they would meet for lunch or even for tea, afternoon tea sometimes. But through this project, it felt as if in most homes that this had really grown and even improved the social dynamics. In terms of volunteer support and management, so that really depended on how the project was set up, and how much time staff had to devote to supporting volunteers. And actually in one home where there wasn't any volunteering happening before and not much of a social interaction, staff and one member of staff was responsible for coordinating it, found it really difficult and felt it couldn't support the volunteers enough, but still tried to engage them and motivate them, help them setting up whatever they needed to set up for their knit and natter, for example, or their board games, but felt and it kind of almost fell through because the residents had a low level of confidence and really needed the support of the staff. And that example really showed us and me that the support needed, which is through just encouraging, engaging, spending time and talking to residents, was very important in ensuring that the project was successful. I'm really sorry that I couldn't go through all of those questions, but we have come to the end of this webinar. I want to thank you again for listening, for sending through all of these questions. We will be sharing the slides of the webinar just shortly after we finish it, together with some links to resources that we have produced. So there's a full evaluation report, there's a blog post that I have written, and there's the good practice guide that was produced by Abbeyfield, which provides a bit more of a practical tools and checklists if you're thinking about how to engage older people in volunteering. Thank you again for signing up, and I hope you enjoyed it. If you have any other questions, please feel free to contact me. Yeah, thank you.